everyone, my name is Nhi Tran, Vice President of VietMD.net, a non-profit healthcare organization dedicated to helping Vietnamese patients and doctors. It is my pleasure to have Dr. Long To as our guest speaker for today. He is a clinical pharmacist and also VietMD's Director of Pharmacy. He's here with us to talk about residency in pharmacy.
Thank you for having me here.
So Dr. To, could you tell us a little about your background?
Sure. I received my PharmD from Wayne State University College of Pharmacy, and then I completed my first year residency training, or PGY1, at the Medical University of South Carolina in Charleston. For my second year residency training, I specialized in pharmacotherapy, and that's at Henry Ford Hospital in Detroit, Michigan. Currently, I'm the cardiac ICU pharmacy specialist, and I'm also the residency program director for pharmacotherapy residency.
Wow, that's a very impressive background.
Thank you.
So could you give us an overview about residency training and what types of residency there are?
Sure. So after the student finished the fourth year of pharmacy school and gets a PharmD degree, the student has the option to participate in a residency program. So that's what we refer to as the first year general pharmacy practice, or PGY1, which is postgraduate year one. So to do that, the resident has to go through the match, which is sponsored by ASHP, which is American Society of Health System Pharmacists. After completing a first year, the student can, or resident now, can go on to complete a second year residency, which is PGY2.
Okay.
And during the second year is when the resident will specialize in a certain area of practice. So there are a lot of different areas that the resident can specialize in. Some common ones are cardiology, ambulatory care, infectious diseases, critical care, and internal medicine. There is one exception to the rule where for pharmacotherapy residency, it can be either 1 year or 2 years. For example, my program is 2 years. So if the resident does that, then the resident only have to go through the match once during the first year and complete a 2-year program.
Okay. So in medicine, that is the match for residency. We also have one in pharmacy. So could you give us more details about pharmacy residency and the match?
Sure. Pharmacy residency, the match that the resident goes through is very similar to medicine. In December, ASHP will open up the application process, and the student can then submit their CV, complete CV, letters of recommendation, transcript, and their personal statement. The program will then go through all the applicants' application and then rank their top candidates, and then they'll invite the student to an on-site interview. So they'll take into consideration the application and also how you do during the interview. And then toward the end, that's during February and March. So toward early March is when the program will then submit a list of their top candidates, and then the candidates will then also submit the list of their top programs. And toward the end of March is when they find out who matched to where. And the match goes from December to March. Okay, but some things that the student can do to improve the chance of getting an on-site interview is to go to the ASHP mid-year annual meeting. So that's the biggest meeting of the year, where all the programs are there, and the student can go to any of the program and talk to the various director, the current residents, and really find out more information about what the program is like and whether it's a good match for that person. Now, that portion is called the residency showcase during meeting, and the only disadvantage with doing that is that it's very loud and very busy. So imagine thousands of students and residents and directors there with hundreds of programs, and you're trying to kind of squeeze into the booth and trying to talk to someone there. What I really highly recommend, is that the student actually do what's called PPS. So that's also available during mid-year. So PPS stands for Personal Placement Service. This is where you get a more private audience with the individual programs. So this actually opens up in October. You can register for it. The fee, there's a small fee for a student, which is about $80. Once you're in, you can browse through all the programs that are available or that are participating, and you can set up a 20-minute interview. And there, at that interview, think of it as a pre-interview. That's where you can talk to the director and some residents as well and really get more information, get all the answers to your questions.
Okay, so how many programs can you rank?
There isn't really a limit to how many programs you can rank. Typically, to do a PGY1, because it's so competitive, usually students rank about 8 to 10 programs.
Okay.
Now, the key to ranking is you need to make sure that if you match, that you're going to be happy at the 1 year, right? Because it's a whole year commitment. So usually, it's difficult to find 8 programs that you really love. But that's to be safe. Some students, if they're really strong and confident, they can rank maybe just 5 or 6 programs. But the key is to remember, if the program is on there, there's a chance that you will match with that program. So you have to make sure that you're willing to be there for a year.
Okay. So what do residents do during their training?
So the residency training year can be very challenging. The focus or the goal of the residency training is to develop a clinical independent practitioner that can really practice in most environments. At the core of this training is direct patient care, where the resident develop this clinical skills, right? And this is where you learn how to apply the knowledge that you learn in the classroom to real life patients. On top of that, there's also clinical research development, where the resident is responsible for a longitudinal project for the whole year. So the resident will learn how to design the project, how to write an IRB, how to data collect, data analysis, and also present the data at a conference. And then at the end, the resident is responsible for writing a manuscript suitable for publication. So those are the 2 big skills that the resident learned. There are various other skills as well. So teaching. So the resident will also precept students. They'll give an hour-long CE presentation and do in-service to physicians, nurses, and other healthcare providers. On top of that, the resident will also develop communication skills, time management skills, and leadership skills as well.
Okay. So as a program director, what advices can you give for students to make themselves more competitive?
Sure. So what I recommend is that you make yourself well-rounded. So instead of just focusing on studying the lecture material and then taking an exam and getting a 4.0 GPA, that you diverse yourself and develop more skills. So remember, I said that residency training want to develop a clinical independent practitioner with various skills. So what I recommend is that you not only maintain your GPA, but also focus on extracurricular activities. So volunteering, taking a leadership role in a student organization, and try to participate in some sort of clinical research. These are all the things that programs look for in an applicant when they rank them. So most programs will have some sort of system that are based on points, right? So if they look at the application and all they see is that a student has a 4.0 GPA but nothing else, that may get the student 3 or 4 points. But if there's an applicant that has various other things I just mentioned, this applicant could, even though maybe with a GPA of 3.5, could get 15, 16 points. So that, as you can see, the big difference between a well-rounded applicant and a student who's just mainly focused on taking exams.
Okay. So thank you very much for being here today with us.
You're welcome. It's a pleasure to be here.
So if you have any question about pharmacy or pharmacy residency, please feel free to contact VietMD at www.VietMD.net, or you can email us or contact us on Facebook. Thank you.